Hi, everyone. Thank you for joining us here today. Sharon and I are excited to share with you some new advanced care planning resources for a palliative approach in long-term care. So if that's where you think you are, you've made it to the right spot. I know there's still a few people logging on, so I do want to be mindful of everyone's time. So I think I will just get started and jump in. So my name is Karen Dietrich, and I am the Director of Advanced Care Planning at the Canadian Hospice Palliative Care Association. And I'm joined by Dr. Sharon Kaasalainen from the McMaster University and project lead on the Strengthening a Palliative Approach in Long-Term Care, also known as SPA-LTC. I love that acronym. Anything SPA in it is always a good thing. So you'll hear mostly from Sharon throughout this presentation, but I will be here as well, providing a little bit of context and introduction around some of the work that we've been doing and where you can find some of these resources. So I would like to acknowledge that the Canadian Hospice Palliative Care Association is located on the unceded territory of the Algonquin Anishinaabe people. We are very grateful and thankful to live and work and play on this land, and especially grateful for the warmer weather so that we can play a little more outside on this land. So I'm hoping that wherever you are joining us from, that you have the pleasure to do that as well. If you would like, please feel free to introduce yourself in the chat where you're joining us from. Things that made your week, whatever gives us a sense of kind of where you're at, where you're joining us from today, and some of the perspectives that you might be bringing with you today. So that just helps us to understand who is on the call. So what you can expect over the next hour or so is a little bit more information about advanced care planning in Canada, so the initiative that I lead, as well as the Strengthening a Palliative Approach in Long-Term Care initiative that Sharon can speak to, and just really how we've been working together a lot over these past few years. Sharon will go into an overview. There's a lot of new resources coming out, and so we thought, you know what, instead of just you exploring them on your own, we'll give you a little bit of background, some information about what to expect in each, how they're intended to be used, and so just also to give you a chance to ask some questions. So throughout this presentation, please feel free to put your question in the chat, and I will bring that forward as Sharon is talking, or Michael, who's also helping us out with this webinar, can bring them forward if I'm speaking. If those questions start to slow us down, we might hold them to the end. So we do have time for questions at the end as well. Sometimes it's just easier to answer the questions right away, and kind of helps just keep the flow going and high energy. So please don't hesitate as we're going through different information today to put your questions in the chat. The video recording will be shared with anyone who registered and was not able to join us here today, and the slides will also be available. So after the webinar, you'll get a brief survey just for some feedback to help us improve our various events. And also after that, you'll get a follow-up email with, again, a link to the recording and a PDF of the PowerPoint presentation. I think that's yes, perfect. So we do have a couple of polls just to help us get to know where you're learning about us from, and kind of, again, who's in the room and the virtual room and where you're coming from. So we'll kick off with the first poll. Perfect. Thank you, Michael. So if you can just let us know how you heard about this webinar. It's very important for us to learn where people are learning this information from. If you selected other, so if it's not in any of the options provided in the poll, if you could just post it in the chat, that would be wonderful for us. So we'll just give that a few minutes. Well, no, not minutes, seconds. Seconds go by slowly when you're just waiting. Yes, I'm in Ottawa as well too. So yes, beautiful spring day that I'm hoping to get out to at some point. Happy St. Patrick's Day out in Alberta. Is anyone wearing green? I should have worn green today. I didn't think about it. Got some folks joining us from Nova Scotia, Grimsby. Perfect. So Michael, if we're done with that first poll, could we open up the second? Oh, there we go. We can see the newsletter. Okay, well, that's great. Good to hear people are learning about it there. And your workplace, wonderful. Great to know that word is spreading and people are sharing this information. And then we just have one last poll. Again, just to help us understand where you're coming from. And just like poll number one, if you don't see your primary role, I know many of us are wearing many hats. So if you're not sure, if you can just select the one that maybe it's your primary role right now, your primary role for sitting here listening to this information. And again, if you don't feel that you have an option represented there, please select other and put your response in the chat. Perfect. A lot of others. Wonderful. So if you can please put some information in the chat about that other section, it's really important for us to understand. So we have an idea of who these tools and resources are for, and the more we learn about who's interested in them and how they're being used, the better we can customize them and engage you in their future development or new tools. Wonderful. Educators, end of life doula, educator volunteer, perfect. Thank you so much, everybody. We really appreciate you taking the time to share that information with us. So this is a joint initiative the result of this webinar, the presentation of this webinar, a lot of the work that we're going to be speaking with you about is through a collaboration of a lot of individuals. So within Advanced Care Planning Canada, the work that we do is informed by advanced care planning champions and leaders from across the country. And so we bring that together to help to learn from what's happening on the ground and spread the word and impact. Similarly, at the SPA-LTC initiative, Sharon can probably provide more details about it, but it is a network of individuals from across the country who are working together with family members, different researchers, different professions, long-term care homes. So everything that we're doing in collaboration to try to ensure that we are meeting people where they're at and solving the problems that people are experiencing right now in their day-to-day, and then learning from that information and sharing what we learn with others. So the project is current. So we also want to thank Health Canada. So the tools and resources that you're going to learn more about here today, as well as some others that you can discover on our websites, have been made possible thanks to a contribution from Health Canada. So we do want to thank and acknowledge their financial support. This would really not be possible without that. So thank you very much. And CHPCA, so the Advanced Care Planning in Canada initiative, is hosted at the Canadian Hospice Palliative Care Association. So even though you might go to the website, it looks independent, we really act as that lead in this collaborative initiative to bring all of the players together and to maintain the website and get those newsletters out and keep the information moving. So that's just a little bit about the different players involved in this initiative and the things that you'll see. And we're excited to continue to work together, but there's a lot to cover, so I will keep moving forward. So some basic information just to make sure we're all coming at this from the same place, or at least you can understand where we're coming from. So when we speak about advanced care planning, we're really talking about that process. We're talking about that process of thinking, learning, reflecting, communicating about future health and or personal care if someone's not able to speak for themselves. So it's really an upstream approach to planning for what may or may not be coming, and it's an ongoing process. When we are thinking and talking about a palliative approach to care, we are talking about a person or a family's full range of needs. So you can see those there at all stages, not just at end of life. So again, that upstream perspective and that diverse perspective of supports, physical, psychosocial, and spiritual. So that's where we're coming from in the work that we do. And we know there's many definitions out there and different perspectives. So we just wanted to be straightforward with that. We're going to talk about a lot of different information. So right up front, if you want to find these resources, and I'll review this again at the end with a little bit more specific detail about where specifically on the Advanced Care Planning website you can find these resources. Some are currently available, some will be available. Literally, some of these will probably get posted next week. So we were doing everything we could to get them ready for today, but they will be available shortly. So we'll review that, but these are just for quick reference and for anyone who missed the recording and wants to learn more. These are two wonderful places to go to get the information. On advancedcareplanning.ca, the tools and resources are available in English and in French. And so with that, I think I will hand it over to Sharon to go over a lot of valuable tools and resources.
Oh, I was really enjoying listening to you, Karen. But I guess I better start. So Karen did a lovely job introducing kind of where we've come from and where you can find some of the resources, uh, which is fabulous. And I love the definitions that you used. I think they work really well in long-term care. Because in long-term care, as we know, it's a sector where we don't have a lot of time to prepare residents and families and staff for end of life, and yet people come in with a lot of work to do. So it's a unique sector to work in, different than primary care. So I think those definitions work really well for us. So today I'm going to get to do the fun part really, and talk about some of the work that we've been doing with Karen and others from CHPCA. And we've actually done a lot of work. I was just speaking to my team about this earlier. A bit of a whirlwind, but now we can kind of pause and reflect, and we've really done quite a bit. So I wanted to try to find a way to organize the tools so that they're easier for people to use and understand for who and when to use them. So we have first off, we have a video, and we'll talk about that resource in the coming slides. And then we have a couple of resources specifically designed for families. So there's a comfort care booklet with a question prompt sheet. We're just wrapping up a study that's been evaluating these resources. And this is really intended for families of people with dementia, and particularly end-of-life stage dementia, so preparing for death. I'll give you a little bit more information about that as we go through our slides. And then there's also an advanced care planning resource that looks at different illness trajectories that are quite common in long-term care. So dealing with some of the front end, we like to call it, or earlier conversations to help prepare residents and families for later on decision making at end of life. And we've also because of the funding for this initiative, we've had a strong focus on supporting staff because this really was intended to support people during COVID, manage everything that they had to manage during COVID, and trying to leverage some of the work that we've done before COVID. So really customizing some of that work. So we have a good emphasis on staff. And we've developed some conversation guides that really align well with our ACP resource for families, those illness trajectory pamphlets, but this one is intended for staff to help support them. We've developed some case scenarios because we find there's very common situations that we've seen in practice, we've seen in our work as researchers, and we've heard from people working in long-term care. So we've developed some case scenarios really as a teaching tool for personal support workers or healthcare aides. And then finally, some comfort care rounds that we have been doing for at least a decade and a half, and now realizing and hearing how helpful they are in practice. We've developed a facilitator guide, again looking at common situations. We have a facilitator guide to help staff work through those situations together. So next slide, please, Michael. There. So this diagram is really a conceptualization of what we see as SPA-LTC leads. We have a team of 7, our original 7 we call ourselves. We see these are the main goals of our SPA program, to help prepare families and residents, and that's done through advanced care planning activities and using resources. Symptom management, we all know in when thinking about people who are dying within a palliative approach. This is something that's most important to residents and families to have their symptoms managed well. We have another focus on building caring relationships. And this is something really that's it's emerged as fundamental over the last few years. And how can we build caring relationships to help implement a palliative approach in long-term care? And then finally, organizational capacity. So what things can we do to help support homes and build capacity? Thanks, Mike. So all of our research for the next slide is based on participatory action research. So this can be a fun way to do research in that sometimes you never really know where you're going to end up, but you learn so much along the way. And essentially, you can't go in with too strict of goals or research objectives because you need to find out what the gaps are, what the needs are, and build on current resources and expertise. So all of our work is based on PAR, and it's really good quality improvement. Many of you probably do this in your own practice. Get data, you do some chart audits, reflect on it, and what do you need to do to improve practice based on that information. So very, very common and helpful. We like to see our research staying close to clinical practice. Great. So this is a video. I will not take credit for this video at all. It was my very good colleagues in Saskatchewan who developed the video and co-designed it along with their family advisors in their network. So if there's anyone in Saskatchewan at the webinar, you may know about the Saskatchewan Long-Term Care Network. It's a new network as of 2 or 3 years. It's been led by Paulette Hunter and Abigail Wixon-Griffiths and some family advisors. Marlene Moorman, who we actually had speak at one of our community of practice sessions, is also involved. So all of the work that they're doing is really grounded within a family-centered approach. So they developed this video really in response to COVID and some of the the tough things that we were seeing during COVID in terms of family restrictions and not being able to visit residents. So this video is accessible. We'll give you the website, and I think Karen will walk you through where you can find it. It's not very long. If we have time today, we could play it. But knowing Karen and I, we generally talk too much and won't leave a lot of time left. But it's easy for you to access on the website. But really, supporting the need to put families front and center and as a main team player in the care circle. So there's some really wonderful descriptions and sad in some cases around their experiences during the pandemic and what it was like for these family members. So we'll move on and talk about some of the resources we've developed for families or significant others. We can move on to that now, Michael. Thanks. So this is, many of you actually may know about the Comfort Care booklet. It definitely didn't start with us. Dr. Marcel Arcan, who is a retired palliative physician, he was at Laval. So he developed this booklet based from some research funding he received from the Alzheimer's Society at least 10, maybe even 15 years ago. It's a booklet that's always been on my bookshelf. I've loved it as soon as I saw it and always wanted to do work with it. And it's very informative. It's not short. But answers a lot of common questions that families have for residents with dementia at end of life and long-term care. So very, very packed full of information, high quality information, and a wonderful resource for families, and staff as well have enjoyed it. So it talks about some common issues, questions that have emerged around feeding, difficulties, pneumonia, And we've built on it over the years. And this version, actually, we used in a current research study. It's a 6-country research study. It's been translated in at least 7 languages. And we've updated it to include a little section on MAID as well, because that's a common question from families. And really trying to provide the kinds of information that families tell us that they want to help make informed decisions at end of life on behalf of their family member. It also talks about the dying process, what to expect, what that may look like, and prepare families for grief and bereavement later on. So the next slide here, this is a newer resource that we developed from that 6-country research study. Jenny Vandersteen, who some of you may know from the Netherlands, worked on developing this question prompt sheet. And essentially what we did, we went to family members, had them review the booklet, and asked them what kinds of questions they may have still. So what we found is sometimes families need permission to ask some of these questions, or they have a question, but they don't quite know how to articulate it. So that was the intention of this, was really trying to get families prompted to ask these questions that are important to them, and make sure that they're as informed as they can be for end-of-life decision making. So this is another sheet that can be accessed through the website, and aligns up well with the booklet. You'll see when you look at it, the questions really align well with the content in the booklet and moves things a little bit further. So the booklet question prompt list are really intended more for goals of care decisions, so more end-of-life decisions. Excuse me. Whereas this resource is more intended more for advanced care planning. So when people come into long-term care, many of them, unfortunately, haven't had any advanced care planning discussions or reflected themselves on things that are important to them and values and beliefs that would be important to uphold for them at end of life. So this is a way that we can share some of those important things that families may want to consider and residents may want to consider. And we've developed this from our earlier study. We've got a lot of positive feedback from it. And during COVID, we realized we needed a virtual resource because our original ones were pamphlets. Tamara Sussman led the development and evaluation of those pamphlets, but they're a bit cumbersome to download because it's a trifold. And we were hearing from families that they wanted something a little bit more user-friendly. So we developed this virtual pamphlet with CHPCA to use during COVID. And I'm not sure if this has been released yet. We have a series of pamphlets of kind of the main chronic conditions that you would see in long-term care. If it hasn't been released, it's going to be released very soon. We have down here March 2022, so make sure to take a look on the website, and I'm sure they will be up there very soon.
I don't think they're there today, Sharon, but I think probably by next week they'll be up on the site.
Okay, excellent. Thank you, Karen. Thank you. So yeah, so we have to keep some things in suspense. We can look forward to that. So this slide, really just shows on some of the evaluation that we did on the pamphlets, which is the same content that are on the virtual pamphlets as well. Tamara led both of these publications. If you're interested to see some of more details about how they were developed, how we evaluated them, and some of the findings that we heard from staff and family. One of the key things we found, it definitely helped encourage some reflection for residents and families about things that are important to them and things they need to think about, questions they may have. And they said that they felt more comfortable talking about end of life, but it didn't actually get them talking more about end of life. So we realized we needed some tools to be a bit more action oriented, to actually have them have those conversations with families and staff. And I think we'll move on to the staff ones now. So what we heard when we were, for families, when they were using those illness trajectory pamphlets, sometimes they would go to staff with questions, but staff sometimes didn't have the answers or felt comfortable answering those questions. So we realized that we need a little bit of work to help build capacity within staff to be able to support families and residents with those questions. So Dr. Abigail Wixon-Griffiths at the University of Regina led the development of these orientation guides or conversation guides for staff. So there's 5 or 6 of them, 5 that line up with our pamphlets. So there's one on dementia, frailty, advanced lung disease, heart failure, kidney disease. I think that might be all of them. So those are the pamphlets, and then we have a booklet to help build capacity in staff for each of those conditions, as well as an additional one for falls, because as we know, falls are a very common event in long-term care, and staff, often it triggers conversations from families with staff. So we've added a 6th one with our toolkit around falls. And it's a very user-friendly kind of tool where it guides staff through, what are some common questions families may have, provides a little bit of information so staff can feel a little bit more knowledgeable and have the skills to answer those questions. And hopefully provide more support for families when those questions emerge. So with those conversation guides, we have an introductory video as well to kind of give people a sense of what the guide involves. The video does a much better job than I do in explaining them, and a little bit more engaging. So maybe we could, let's play the video, Michael. Thank you. I don't hear anything though. Is that just me?
No, I don't hear it either. That's all right. One moment. Of course, we tested this in our practice run. This is
I know.
The Illness Trajectory Complementary Conversation Guides, a new resource meant to encourage engagement in advanced care planning conversations, supporting a palliative approach to care. Our complementary conversation guides offer information on how to facilitate conversations with residents, families, and friends, and help guide healthcare providers on how to respond to commonly asked questions about supporting a palliative approach to care. The complementary conversation guides also offer information on frailty, dementia, advanced heart failure, advanced lung disease, advanced kidney disease, and an extra conversation guide centering around anticipating a fall-related injury. The Illness Trajectory Complementary Conversation Guides are meant to help tackle the hardest questions to answer, such as, how can I maintain quality of life? What should I expect when my family member is dying? What is chronic disease? What is it like living with an advanced disease? What are the signs and symptoms my family member or friend is approaching end of life? These conversations are necessary, but can be difficult to have. We have created these conversation guides to help you provide the best care possible. For more information about the Complementary Conversation Guide booklet, please visit our website at www.SPA-LTC.ca and explore our library of resources supporting a palliative approach in long-term care.
Great. Thanks, Michael. It just makes me realize we didn't include the Advanced Care Planning website, which will likely host the video and the resources first. So you always learn something too late. Yeah, that's great. Thank you. So one thing I should mention, the Saskatchewan group developed the video as well as the conversation guides with family members. They were co-designed together, so they're very family-centered and really hopefully responds well to the needs of families and the questions that they may have. So another staff tool we developed, because we all know how important the personal support worker role or healthcare aide role is in long-term care. And yet what we were finding, they're not often included to a lot of the education and training sessions, which is very unfortunate. So, how can we help build capacity and comfort and knowledge within personal support workers to help them to be able to implement a palliative approach? So we decided to, first off, build some ways that people can work within the home to do some of this teaching and education. So this is intended really for a group activity. So it would have either a director of care, an educator, ideally, an advanced practice nurse, social worker, anyone who has the expertise within palliative care and implementing a palliative approach to help hold a session with PSWs. So it's a tool for facilitators to guide these education or training sessions with PSWs, and I would say even beyond PSWs, other support staff as well. They're really well done, very in depth. And they each of them have the same kind of format. So they have an introduction, a little bit of guidance about how to use the facilitator guide. There's a scenario to provide a little context for what the topic is for each of the facilitator guides, the sessions, and then goes through what's some key learning content. So what's the key nuggets that we feel are important for PSWs to know to be able to manage a situation like the one in the case scenario, and then leaves people with some questions for reflection to get people thinking a little bit more about, what does this mean for me? How do I feel about this? What future learning might I have, and how can I apply this to my practice? So again, designed for PSWs, really anybody who works closely with residents and families. I don't want to limit it just to PSWs, but certainly they were our target group because they aren't often included in education and training. And some of the activities that are in the guides come from what it's like to be a PSW and common situations that they deal with in their practice, like balancing the risk of falls versus independence, maintaining a quality of life, and respecting cultural values. So these topics came from a study that Tamara Sussman and I just finished. These were common topics that we saw were charted in long-term care homes that were in patient records, essentially. So scenarios that were charted, but we weren't sure how staff responded to meet the needs of residents and families. But certainly they were common situations that happened. So these are expected in April, probably one of our last resources to share. So stay tuned and keep an eye on the website for those to be posted. And the last resource that we'll share today is based on the Comfort Care Rounds that have been used quite a bit over the years. I've learned about them. In Ontario, we have palliative consultants that are situated in the community but work closely with long-term care homes. And Mickey Turner, who's now retired, was who I worked with, and she really mentored me around using these. She was excellent, and would go into long-term care homes and have staff come and sit in a room for about an hour and talk through some difficult deaths, good deaths, bad deaths. Allow staff a chance to reflect on those deaths, what went well, what didn't go well, and essentially, what learning can happen based on that reflection and those experiences. So it's very much kind of informal learning and as needed. So you need someone fairly skilled who can respond to questions and feels comfortable answering those questions. In our case, palliative consultants were excellent. I know many nurse practitioners who have palliative care experience are good. And I've worked with a home. Now we're seeing more long-term care staff getting palliative training, the fundamentals of palliative care or LEAP long-term care. So we're finding there's internal champions who can run comfort care rounds. So there's 8 different scenarios. Again, Dr. Abigail Wixon-Griffiths worked on these when she did her PhD with me. She worked with me on the comfort care rounds and actually published a paper. So these are common scenarios that we've noticed are talked about in comfort care rounds and follow a similar kind of format as the PSW case scenarios. Really aim to create teamwork. So this isn't just for one type of care provider, it's for nurses, RNs, RPNs, PSW, support staff, really anybody who is interested and able to kind of participate, because I think the more they can learn from one another, different roles, the better. We've certainly seen that in our work. So the goal really, to increase confidence, build capacity and knowledge in staff, and help support families and residents, along the way. And if you're interested in getting any kind of evaluation findings, happy to share some of our publications. There's also, for those of you who know about the Palliative Alliance, Mary Lou Kelly and I worked on that before our SPA work. There's a toolkit that we've used for homes to be able to implement these as well, with different flyers you can put up to let people know when the comfort care round is and where it will be. But this is taking a lot of that work to the next level, which is great. We want to build on what we're doing. There's always room for improvement, and as we learn, about needs and how to best support staff, that we try to respond to that as best as we can. So here's an example of what a comfort care round scenario looks like. So you can see, it gives a nice clear picture of the case. So it provides some context, moves into the topic area. So there's one specifically designed to address family conflict, which we hear, again and again, how challenging it is. When there's conflict within a family, siblings not agreeing on what should happen. So this offers a way to kind of help people work through those kinds of situations and offers suggestions on how to manage it. Again, good and bad death. This is something I don't think we talk enough about in long-term care. And staff need to feel supported to talk about particularly the bad deaths, which can be very difficult to deal with. And nutrition as well. How do you support nutrition within a palliative approach? So there's some guidance on that in one of the comfort care round scenarios. Great, and I think I hand it over to Karen now.
Thanks, Sharon. Before I jump into just a few more things, Jerry had a comment in the chat, really wondering why personal support workers aren't included in all the education, and referencing the work that Kath is doing at Life and Death Matters for personal support workers. So, I mean, Sharon, I'm not sure if you have some thoughts on that, but I know I've heard a lot of possible reasons or explanations. I wouldn't say reasons, maybe people kind of rationalizing it's not, it's they don't have this, or they don't have that, or they're undervalued, or, there's a lot of different thoughts, perspectives on why that happened. But I think I have seen efforts to remedy that or move towards including personal support workers. And as you said, kind of all of the teams in long-term care, from, from people working in the cafeteria to like really inclusive education, and balancing that between people's jobs, needs, requirements, certifications, timing, training, budgets, and all of those things. But Jerry, your point is well taken. I think a lot of people went, well, why haven't they been included in that? So Sharon, I don't know if you wanted to add anything to that.
Yeah, no, I just want to say as well, they should be. I think we all kind of recognize the importance of them being included in the education. What we found, we've worked really hard trying to get PSWs at training sessions, at comfort care rounds. Often it boils down to funding. I think it's costly to pull them off the floor, or to have someone replace them. But it's interesting because it's more expensive for a nurse to be replaced. So it makes me think, maybe they're not. It's not seen as a priority. They don't feel it's it's needed as much. We have seen some cases where we've tried to have PSWs with nurses in a comfort care round. One of our stellar homes, but there was a bit of pushback from the nurses, which surprised me, to be completely honest, feeling that they wanted to talk about other things and didn't feel the PSWs, they have a different scope. And so there was some interesting dynamic there. So in that case, we had comfort care rounds just with the nursing staff, and we tried to have it with the PSW separately as well. But I think that's changing. I think it's changing, and I think we're going to, just looking at the education now that's rolling out for PSWs, it's certainly, being recognized as critical, and hopefully there's funding and support for them to be educated. It's tough enough just getting a champion team pulled off to, and that's like 10 or 12 people for a 120 bed facility to get them training. But I think, we need to definitely focus more on that. Our work has clearly shown that PSW support staff have the lowest level of comfort with having conversations at end of life, but after attending education session, they improve the most. So we need to get them there to those training sessions. They need it the most, and they benefit from it the most. So yeah, and the other thing we're hearing, asking families, who do they feel comfortable talking to about some of things that are important to them, and some of their end of life thoughts. And I'd say 80% of the time it's usually PSWs, because that's who they see most often. That's who they have a close relationship with. It's not the physician. It's not all, there are times when, families do want to have the physician to speak to, but I think we can't assume it's always the physician or the nurse. And it's important to ask the families and the residents, who do you want to talk to about these things? So, yeah. So, anyways, great question. Hopefully, when Karen and I are doing this 2 years from now, we'll have different things to say about it, better things.
Thanks, Sharon. So I also put information about the Palliative Care Education for Personal Support Workers program that CHPCA has partnered with Hospice Palliative Care Ontario and Life and Death Matters with. So it is a national online program. And, Life and Death Matters has been providing personal support worker education for such a long time, saw this gap. So we're excited to be able to offer that online learning. There are challenges, and we are working with long-term care providers, so the facilities and others, so that they can provide that training, provide the time off to take the training, all of these different kind of complexities of actually making it a reality. But so far we're focusing on the development and just reaching people. So I just put that in the chat in case anybody's interested in learning more. Here are just a few additional resources. So as Sharon said, we've been busy. So some of these have been around for a year or more, but I just wanted to bring them forward in case folks hadn't heard about them before. So one of an initiative that Sharon and I co-chair is the Palliative Approach in Long-Term Care Community of Practice. So this is a group that meets once a month. We might be changing to every other month. We don't know. We've got a survey out with our members right now. So if you are a member of that community of practice and you didn't see the survey, you will. But really, this is a group that is open to everyone and anyone with an interest in palliative approach to care in long-term care communities. So residents, all staff, different practitioners. If somebody just has an interest in it, has seen it, it's really an open group. We have a lot of guest speakers. So we've had Tamara, who Sharon referenced a few times. We try to bring different perspectives. Compassionate Care Project. Last time we talked about NAV Care, which is a volunteer group, volunteer program that helps with different residents and looking at how they have partnered with long-term care organizations so that as people are making that transition, they're supported. So again, a very upstream approach. So this is a group that is open to whoever wants to join it. And Michael's put the little link there in the chat. If you're interested in learning more, you can sign up online and choose to attend or not, whichever sessions you find of interest. The Essential Conversations Guide, that is actually one of the first resources we released. And so we actually did an entire webinar just on it. And it really is looking at advanced care planning in long-term care settings. So when should advanced care planning happen? Who should be involved in it? What does it look like? So really getting into some of those mechanics. And we're in the process of releasing two kind of, I'm going to say, not tip sheets, but like quick reference documents. So even though this guide itself is not hugely long, what we've learned is, 1 or 2 pages worth of content to look at and digest and explore is a much easier entry point perhaps into some of these tools and resources. And so there's 2 kind of tools that will be coming out probably in the next few weeks. Again, it will all be in the same place I've talked about, but you can take a look at the Essential Conversations Guide. And actually, Sharon and I did an entire webinar on that one. So if you want to do a real deep dive, the recording is also available. We also developed a repository of resources. So not only are a lot of the resources we've been talking about here on the site, but there's other people's resources. It's been a very busy few years, especially around long-term care. And so we started looking at what else is available. What are people using? So there is a repository that is also available on the site, and a new video that's coming along. So there's a video that was created, gosh, I'm not even sure when, a long time ago, called All on the Same Page. And it really is about getting residents, family, staff, all on the same page about what's most important to the resident going into long-term care. So this is a video that is meant for families and residents as well as staff, because it's about getting everybody together. So what is palliative approach to care? What is advanced care planning? And then it walks through a family care conference, what that would look like, what to expect. So again, it's to provide some information so that somebody who's never been through this before has an idea of what maybe to expect, what it might look like, but recognizing that it's going to look and feel different depending on where you are. Every home is different, every family is different, every resident is different. So that will be coming out. That should be out by the end of March too. There's, as you can tell, a lot of stuff is coming out. So we wanted to provide you with some information of things that are already there, but also let you know what to look out for. Actually, I think this is where, so we will go into the Q&A, but Michael, if I can get you to stop sharing, I will share my screen. And one thing that I'm not sure if you guys, we all know our own websites really, really well, but navigating into somebody else's is sometimes a bit of a different ballgame. So we've tried to make it as easy as possible to find. If you go to advancedcareplanning.ca and you just look for the resources and tools blue button, I believe this gets you to the same place too, but this is the one I'm used to going to, so that's where I'm going to go. Here you can look at various resources and tools filtered by different groups or different resource topics. So if you go into long-term care, that is where it will filter, sorry, I'm not scrolling very well. It will filter out some of the other resources. So here's that essential conversations guide that I was just talking about, gives you a little bit of information about what it is, and then a link to download it, and then related resources. So we always try to add related resources. So if you have information or questions, sorry, if you have questions about other things, or this was of interest to you, maybe this will as well. So again, if you go to advancedcareplanning.ca, tools and resources, and filter by long-term care, that's where you will find all of these resources. So everything that we talked about will be there. The difference between this is these are resources that we've been a part of developing. The long-term care repository of resources, so that was another resource I talked about, it includes other people's resources. So it's filtered by resources for residents, family caregivers, healthcare providers, or researchers. As you expand them, you get links to different resources and who they've been developed by. Again, it's a starting point. It's not perfect. It's not meant to be a clearinghouse of everything that's on there. And this is our criteria for inclusion. If you're wondering what's on there, how did we decide? Very turnkey, so it didn't slow us down. But if you have resources that you think are really helpful and useful, that you've used a lot, that meet this criteria and that you don't see listed here, please email us at info@advancedcareplanning.ca. And as long as they meet those criteria, we will add them there. SPA-LTC has a very robust resource library as well. So, we're coordinating each other. We're seeing where it makes sense to have this information. We don't want people to have to go to too many different places, but we didn't want to wait for things to be perfect before we did it either. So those are a few of the other resources that I just wanted to highlight in case you were wondering where to find them. Okay, we're not bad. We've got 10 minutes for Q&A. So it was a lot of information to cover, and I think we tried to go a little bit more in depth in some of the resources than just what you saw in that landing page. This is what it is, this is who it's for. But if you have any questions, comments, this would be a great time to do it. I know there's the Q&A box or the chat. You can put your question in whichever one you feel more comfortable with. We are looking at both of them.
I might jump in, Karen, while we're waiting for questions to come.
Of course.
It's interesting how you learn, Karen and I work very closely together. I love your resource, your repository for ACP tools, and I'm thinking the new work that you're doing with the scan, looking at tools for diverse populations would be another nice tab to add there, because I think that's something we're seeing more and more, people looking, to kind of get away from the mainstream tools, but how can, what tools are out there, I guess, that can address specific needs of certain populations.
Yeah, that's a good point for sure. We've over the past few years, there's been a lot that's been developed. And so we specifically, as Sharon mentioned, did a scan of what about tools and resources that have been developed for specific populations that are often, that might not be focused on as much as they should be. Or so intellectual disabilities, people of different cultures and backgrounds. I know Canadian Virtual Hospice has wonderful videos about different, I think it's livingmyculture.ca, just different perspectives on what does end of life mean to them? What does it look like for them? And I know in one of the resources you were talking about, Sharon, there is a scenario that looks at culture and it looks at the importance of food, right? And so these things that might seem very simple, but have a huge impact. We eat all day long. We usually get to choose what we eat, and all of a sudden we can't. Right? And how I eat and what I eat and what it means to me is very different to somebody else. So I think that's a wonderful idea, is to just see what those other resources are, and just trying to share what's out there. That repository was really informed from the outcomes of an environmental scan that your team did, Sharon, where there was a lot of resources, but sometimes they're buried. They're buried in a scan where people cannot find them, and Google won't find them. Google might find them if you know exactly what you're looking for. but there's a lot of scans that are done all of the time that gather a lot of this really interesting information, but it's hard to find. So that's part of what we've tried to do with that repository is something is better than nothing. It's not perfect, but it's a starting point. So yeah. I'll take a look at that scan for sure. Thank you, Michael, there for the newsletter too. That's actually, I know a lot of people said they found out about this webinar through that, but we will, whether you're following us on our social media channels, so at ACP Canada, Twitter, oh God, this shows you how I'm not on social media, LinkedIn, Instagram, Facebook, we're kind of everywhere. You know, we will let people know the newsletter. It's all nice in one place for you, goes into your inbox. Goes out usually once a month, so that might be spreading out in frequency, but that's definitely a good place to sign up if you want to know when these things are released. Oh, there's a question in the Q&A. So as a family caregiver looking at long-term care options for my brother with dementia, is there a resource to trigger questions to include who best to ask when looking at options, including a home? Great question, Donna.
Yeah, that is a great question. I don't know where you're from, Donna, but I know in Ontario we have public reporting. You know, how reliable some of the reports are, I'm not sure, but so we have an inspection process with the ministry. I think every year a home needs to be inspected to see whether they meet all the regulations. So sometimes I've actually gone to that website to see, oh, you're from Ontario, great. I wish I knew the exact website. I'm pretty sure it's on the Ministry of Health, but you can see homes that have, you know, done well in their inspections, other homes that maybe didn't meet some of the regulations. That's one way you can look at, you know, homes that might appeal to you. I have good friends and colleagues who are in a very similar situation, and you know, I think sometimes you know, word of mouth, doing some site visits as well to see, you know, what kinds of some of them have different kinds of programs. Like some may have memory clinics or more dementia friendly programs. Some have really good palliative programs, so I'd recommend those ones. But, you know, figuring out, I guess, what are the needs, specific needs or interests that you'd like to see. Not all homes do everything. There are some excellent ones, but it does take a little bit of time. You know, my colleagues have spent a fair bit of time you know, trying to find a home that best suits their family members' needs. And then you run into the problem of waiting lists. You know, it's not an easy process at all, but just some things I can think of right now off the top of my head. Good luck.
Oh, thank you. And then she followed up with a comment. I'm thinking about their focus on ACP involving families. Yeah, I think asking how they involve families is a very important question. Yeah. How will you be informed? How will you be involved? Formally, informally? Those would be very...
Yeah. So another option, if you're in Ontario, is looking at the Family Councils of Ontario network. Samantha Peck is the executive director, and she may be able to help answer that question. Each long-term care home has to have a family council. They're a good resource. But I would probably reach out to Samantha Peck, Family Councils of Ontario, FCO.org, I think it is. She's very helpful.
Wonderful. And we've got one last question we're going to squeeze in before we wrap up from Rachel. Do you find this information is used between provinces? Are there any provinces you find that are ahead of the process? Yes, we've talked about Saskatchewan a lot. Issues that we know regarding the differences across Canada.
Oh yeah, huge. Where do we start, Karen? Yeah, it's I think that's why I like working with CHPCA so much, because it is a national body, and my goal is to do our work that's transferable across the country. There are for sure differences in each province, and we are looking at that as well with some of our scan work, and BC, I would say, is very advanced. They have their Voices, I think it's called Voices, their ACP tool. So different provinces may have a different ACP framework. Ontario, as many of you probably know, we have our Long-Term Care Act with the healthcare consent that we have different kind of boundaries to work within, which creates a lot of challenges with ACP, and I think generally, it is good to work within your own province and look first to see what tools and resources exist in the province. Our work, we try to make it generalizable.
Yeah, I'm thinking about the pamphlets that were revised. They were provincial, and we revised them so they have national resources. So wherever has been possible, we've absolutely tried to make them as national as possible. Sometimes you don't want to do that, right? Because it's very specific to a province or territory. So it is a bit of a game, but we're always directing people to their local hospice palliative care associations. CHPCA works closely with the Canadian Association of Long-Term Care Homes, again, making sure they have this information. It filters through to their members, so trying to get that reach across the country, but it can be a bit challenging to kind of see that. So work in progress, I guess, would be my quick and dirty answer as I look at the time. BC not using my voice much.
Yeah.
Okay.
And Tara, we think alike. We actually, in our website, we built a filter system in for each province. It's really, I think, because of the challenges in Ontario. But so, I mean, we have that filter in. We haven't done a very good job of kind of organizing everything, but that's our goal. And I don't know, CHPCA, I'm not sure what your plans are. We had talked about that within our advisory board of looking at whether the tools are applicable or appropriate for each province, but it's very difficult.
Yeah,
difficult to get agreement.
Yeah, for advancedcareplanning.ca, probably if you go to ACE, in the top navigation, it's ACP across Canada. And we look to our partners to say, okay, where should we be directing people to for each province and territory? And so we actually just did a revisit of those links to update them. So at least you have the right starting point to go to if you're really just interested in what's happening in your jurisdiction. So we try to keep those as up to date as possible.
That's great. Yeah.
So with that, we're a couple of minutes over. So not too bad for Sharon and I, who are both talkers, but I am going to wrap us up. Thank you very much to everybody who took the time to join us. Thank you, Sharon, for making the time to go through those resources. And please thank your team for all of the work that they've done in creating them. We are working furiously, Michael and team included, behind the scenes to get this up and published and available again in English and French. So some of these tools are done. We're just waiting on the translation. So we want to make sure that we get that information out at the same time for everybody. But big thank you for joining us here today, for your comments, for your engagement in the polls. Again, sign up to the newsletter, follow us on socials, or check out the website if you want more information about any of these tools and resources. Thanks, everybody.
Bye.
Bye.